Welcome back. I'm Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. If you're taking a look at this image here to the right, that's not my foot. Not at all. You're probably wondering what's going on. This is some serious gangrenous necrosis. You might hear it described as mummified, right? Mummified is a buzzword for gangrenous necrosis. Let's talk in detail about necrosis. Make sure you have this book. The lectures all tie back to this book. It has everything that you need to know to excel in pathology for medical school, your coursework, as well as on step 1. And actually, it serves as a foundation for the rest of your medical career. So whether you're doing radiology, some sort of oncology surgery, you're going to need to know what you're looking at on those x-rays and images. You're going to need to know what sort of cancer is occurring. You're going to need to know what you're treating and what you're removing as a surgeon. It all ties into pathology. Make sure you have a strong foundation. Get this book. If I was you, I would have had it a long time ago. Let's specifically talk about necrosis, right? I'm glad that we're talking about this lecture. It's one of my favorites, and from here on out, it's only up and up, right? It gets better and better. Necrosis is the premature pathologic death of cells in living tissue. Acute inflammation can result in the death of a large group of cells, which will cause necrosis. Necrosis is always pathologic. Always. Necrosis is never physiologic. Necrosis is always pathologic. Now you're saying to yourself, well, there is no always in medicine, right? You've probably heard never say always or never. Well, in this instance, we can unequivocally say that necrosis is always pathologic, never physiologic. Now, the patterns of necrosis include a handful of must-knows. You will definitely be tested on this, right? Coagulative necrosis, like TB. Liquefactive necrosis, such as in the case of a stroke that caused lack of blood supply to the brain. Gangrenous necrosis, perhaps due to an infection like we saw with that image of the foot earlier on. Fat necrosis, like a traumatic accident that impacts the breast. Or caseous necrosis. Again, TB. We'll talk about these more in detail. And actually, with that coagulative necrosis, we'll touch back on that as well. Right now, actually. Now, in coagulative necrosis, the necrotic tissue remains firm, and in-organ structure is maintained, and even cellular structure is maintained. However, what disappears is the nuclei. In coagulative necrosis, the nuclei disappear. Ischemic infarctions are known to cause coagulative necrosis in most tissues. Infarctions may be wedge-shaped, coagulative necrosis. After an ischemic infarction, if blood is reintroduced to loosely organized tissue, a red infarction may occur. Note the lack of tiny blue nuclei in necrotic tissue. Now, coagulative necrosis does not happen in the brain. Liquefactive necrosis will occur in the brain. Here's an example of coagulative necrosis. We can recognize the histopathology here, top left. You have a gross image, and the remainder, specifically the top right, shows a lack of nuclei. Bottom left, at higher power, you don't really see too many nuclei. coagulative necrosis. Now, what's liquefactive necrosis? For example, after a brain infarction, the proteolytic enzymes that originate from microgliosis will cause hydrolysis and liquefaction of the brain parenchyma. In an abscess, the proteolytic enzymes, i.e. enzymes that break down proteins, cut proteins, proteolytic, the proteolytic enzymes released from the neutrophils will liquefy the tissue. Take, for example, pancreatitis. In pancreatitis, the proteolytic enzymes that originate from the pancreas will liquefy the pancreas. In this image to the right, we have an example of liquefactive necrosis. The center of the abscess contains necrotic debris, and there's a rim of viable inflammatory cells that the arrows are pointing to, surrounding that abscess. Liquefactive necrosis. What about gangrenous necrosis? Well, gangrenous necrosis results from a lack of blood supply that leads to a lack of oxygen reaching a tissue that leads to cell death and tissue damage. There are multiple types of gangrenous necrosis to be aware of, which include dry gangrene, wet gangrene, gas gangrene, internal gangrene, necrotizing fasciitis, and Fournier gangrene. Here's our image again of the foot with that mummified appearance on the 3 digits there. It's an example of dry gangrene, which is a form of coagulative necrosis that resembles mummified corpses, which usually affects the distal appendages. With wet gangrene, that is gangrenous necrosis that is infected by bacteria that promote liquefactive necrosis. Gas gangrene is a medical emergency. All my ER docs out there, or future ER docs, gas gangrene is a medical emergency due to gangrenous necrosis that is infected by bacteria that produce gas, such as Clostridium perfringens. You will be asked that. Internal gangrene is gangrene that occurs when blood flow to an internal organ is blocked, such as an incarcerated hernia, obstruction of the small bowel due to looping in upon itself, things of that nature. Necrotizing fasciitis, aka flesh-eating disease, is a type of aggressive coagulative necrosis with superimposed infection by group A streptococcus bacteria that affect the skin and fascia. Fournier gangrene is a type of necrotizing fasciitis that usually affects the male genitals and groin area. Fournier gangrene affects the male penile area and groin region, okay? Now here's an example of caseous necrosis. Let this image here to the right seep into your brain. You will definitely 100% be asked this question. TB, caseous necrosis, right? Caseous necrosis has the appearance of congealed cheese. This is the most tested form of caseous necrosis, which involves the granulomas of the lungs associated with tuberculosis. Okay? Fat necrosis is the necrosis of adipose tissue that results in the deposition of calcium, actually. This fat necrosis typically has a greasy, chalky white appearance. The process that causes fat necrosis that you will be asked about is saponification. Saponification is the biochemical reaction associated with fat necrosis. Now, what type of calcification is saponification cause? Saponification results in a type of dystrophic calcification. Dystrophic calcification. In dystrophic calcification, necrotic tissue serves as a nidus that calcification may build upon. Now, some classical causes of fat necrosis are pancreatitis or trauma. Now, how does pancreatitis cause fat necrosis? Well, fat necrosis of peripancreatic fat, along with liquefactive necrosis of pancreatic tissue due to the free pancreatic enzymes like trypsin, and trauma to adipose tissue such as the breast. Say there's a motor vehicle accident, head-on collision, female driver, breast hits the steering wheel. That could be the trauma that causes fat necrosis of the breast. Metastatic calcification and dystrophic calcification are two completely separate entities. The difference between metastatic and dystrophic calcification are: metastatic calcification is deposition of calcium in normal tissue due to excessive calcium levels in the system. On the other hand, dystrophic calcification is deposition of calcium in pathologic tissues. Here we have an example of fibrinoid necrosis. Fibrinoid necrosis is necrosis associated with fibrin deposition in blood vessel walls. Necrotic damage to the blood vessel walls may result in fibrinoid necrosis. Necrotic damage to blood vessel walls may result in fibrinoid necrosis. Now, fibrin may leak into the vessel wall, resulting in this bright pink deposit that can be visualized microscopically on the vessel wall. And you can see it here right in the image. Fibrinoid necrosis is a feature of malignant hypertension, vasculitis, and in the placenta due to preeclampsia. This particular image to the right is fibrinoid necrosis in a case of Church-Strauss syndrome. See all those eosinophils there? See that fibrinoid necrosis of the vessel? Wow, complete. Another one down. Now, this is a very important lecture that you just completed. I'm proud of you. You're on the right track. If you have any questions, want to talk, have some suggestions, let me know. Make sure you're subscribed somewhere so that you don't miss out on all the material, because this is a living body of work. Things are constantly updated, new materials added, and make sure you have the book too. The book is key. It's critical. Has everything in it that you need to know. Keep studying. Good luck.